Thanks for joining us. So we also to tell us about WVL Nigeria. Project is Dr. Fatima Adamu. She's the Executive Director of Nana Girls and Women's Initiative. Welcome to the show, madam.
Hello, good morning.
Good morning. So tell us, what exactly is Nana Girls Initiative and what is your primary mission?
Yeah, Nana Girls and Women Empowerment is located in Kebbi State, and we work in both Sokoto and Kebbi. And we're barely about women's rights and girls' rights, and that's what we are. We focus on issue of reproductive health rights of women and girls, as well as economic rights. So these are in brief, who we are. We're purely women's rights organization.
Okay.
Yeah, so, okay. What roles do Actionaid Nigeria and the government of Canada play in supporting and facilitating the implementation of your initiatives?
Oh, a lot. When we started, we're just a small organization struggling. And so what the WBL, Global Affairs Canada support did was really to bring us up with visibility, with a lot of capacity building and really showing us the way. And not only that, we were also, the Actionaid was able to handhold us and also support us to handhold others. So we went to the communities, we worked with about initially 12 community-based organizations. So what I'm saying we've done, and we got some funding also to implement our own agenda. And that's what I like about the WVL. It gives you that space to decide your own agenda, and they support you both financially and technically to implement your own agenda.
So I know that you're an advocate. What you do is to advocate against school-related gender-based violence, and for that to happen, there'll be need for policies. So I want to ask you, what are the challenges you've encountered in trying to push for relevant policies to back up this advocacy you have? Can you highlight some of the successes you've had during this advocacy journey in respect to policies?
Yes. Yeah. So one thing, initially we weren't into school-based violence. It was one of these 16 days of activism that we decided, let's visit schools and hear what is happening. To our shock, when we went there and we asked students after the sensitization and all of that, we asked the student, please, if you have any question around GBV, after discussing what it is, anonymously write it in Hausa and put it in a box. And all of us left, and so they were all among themselves. They wrote. And what we got really shocked us. Some of them were asking, look, if my uncle is raping me, is sleeping with me, my maternal uncle, what should I do? Who should I report to? I don't want to report to my mother because that will tarnish the kin's relationship that they have. So we got a lot of disparate, calls. Or if my teacher is molesting me, victimizing me, who should I report to? So they were asking kind of questions that ordinarily, in fact, we felt ashamed for me as a mother and also as educationists that we weren't paying attention to things like that. So that was really for us an eye-opener, and we pick it up. And so right now, for example, we are working in 16 secondary schools in Kebbi State, and we're working with the government. There is already Safe School Initiative at the national level, wherein there is policy, there is all of that. But that's the issue with the Nigerian government. So it sits here at the national level. So what we did, we really worked with the state government to ensure that that is translated down, not only at the ministry level, but also up to our school levels. So importantly for us, and we've gotten a lot of support. And so in fact, the Ministry for Basic Education secondary education, have even given us a focal person. We are working with them. We've done a lot of training. We are working with them to reactivate, because there is the guidance and counseling. This kind of, many of the questions they were asking, if to say there is a functional guidance and counseling unit and trusted guidance and counseling officer, these are issues that the school could have handled. So because of that, we work with the schools, with the ministry to reactivate because some schools did have, so to reactivate where they exist and really make sure, and we involve the student in the selection of who is going to be the guidance and counseling officer for them. Because these kind of things are issue of trust. They need to trust you before they can tell you their stories. So we work on that. Where they don't exist, we create it.
Well done, ma'am.
Importantly, yeah, thank you. Importantly, is we ask the girls, you have the power. You are a human being. Every human being has a power. So why can't you work yourself? There is power in number. So rather than one individual, so we work with them. So finally, we agree with the leadership, the principals and the vice principals. Let's have a girls' club.
All right.
And this girls' club, let them be very active and let them also be first of all, submitting complaints from their fellow student to the management without telling the name, because we need to hide the identity.
Okay.
And so that was very, very helpful. And we have a lot of, student expressing, had given them the voice, the space to talk.
All right. Let me get a few more questions in for you.
Okay.
Yeah.
I want, given what you've just described and the stories that these children have, sent you, would you say that there are some cultural practices or norms in Kebbi State and maybe Sokoto State that has, encouraged the prevalence of gender-based violence in schools and also regarding maternal health?
Yeah, I think there are. So, and I'm not sure whether it is only Kebbi or Sokoto, but generally there is the culture of silence. So this, I remember adolescent girls, and as parents, we don't listen to them. We are not good at listening to them. And most cases, most of those that are really harassing them, they is the power. It's either they are relatives or they have power over them.
Yeah.
So they feel that for them to really raise the issue, so they are apprehensive, they are afraid what will happen to them. So there are cases they will think, look, one case was the husband of her sister, and she's staying with the sister, and she is an orphan. So if she really disclose the issue, probably even the marriage of her sister will end, and she will also, they don't have anywhere to go. So these are all the chances. So they are adolescents. They don't have the power, the agency to talk. And that's why our intervention under WBL is giving this space, and they say, look, you can talk, and we are here for you. And the whole society is here for you. And the government is also here for you. And we have cases wherein the government will intervene and really address the problem. So the major issue is that lack of power, especially for women and for the adolescent, to know that, look, they can say, they can voice out, they can say what is there. The issue is, if they say that, who will come in to give them that, to support them,
Security.
to protect them, that kind of protection. And because the school, there's how long the school can do, because during holiday they have to go back to home. Whatever it is, some of them are imported. So they have to go back home.
Okay.
And that's what we come into play, the role will come into play as NGOs.
All right, so let's discuss sustainability for a moment. What actions do you believe the state government and even community leaders in Kebbi can begin to take to ensure the lasting impact and success of your project at the state level?
Yeah, in fact, it's not that they can tell. We've started that engagement with them. So, for example, under the school-based, gender-based violence at the school level, we're discussing with the ministry. There is this agile program, another education program. And so the government is saying, look, let's come into that. And we also domesticated the national, and what we have a policy with the government adopted. So we are on that, and the government is looking for other resources like the agile resources so that we expand. So we are now scaling up with the government to additional schools and to have additional girls club in each of these schools, where currently we have 46. And so that's one. Let's come to the community. And for me, that is very, very critical. We've had every emir, all the 4 emirs in the state. We have visited the emirs, and we have what we call paralegal at the community level. And this community, this paralegal team, they are comprising of the security, the Hizbah, that's the religious group, the youth group, the traditional, and in each of the district head, there is somebody that we are working with, and so that's why now we have so many cases being reported. You know, the thing with GVB, for example, for many of those affected at the community, they are the poorest. So they don't have the means even to transport their case to where the court is and where the police is, and even from the police to take it to the court. So you need to all come together. So what I'm saying is we are getting the right signal, and they are really supporting, and we are putting structure at the community level, and with the support of the traditional institutions.
Yeah.
And that's working very, very well. And we are handing over these structures to the emirate and to the district heads in the states.
Amazing work, ma. Well done. So if you have an opportunity
you.
to design phase 2 of your project, what are some of the changes and adjustments you make based on your experience from this first phase?
Yeah, I will definitely. So I would like it to remain women-led, because that's so I want it to remain women-held, and also I want to that space for us to do. But what I want is the emphasis, and I really like to emphasize that we go down to the grassroots, and to the poorest part of the urban poor part of the state, so that then what I'm saying is we add in the issue of equity. So we are not only allowed to decide, but certain number must come from the poor side, because there is the tendency for us to remain in the capital city, but the state level. But that's no majority of these challenges. They are not in the state capital. In the state capital, people have options. It's just like hospital. In the state capital, there are private hospitals. So if I don't want it, I have an option. But for many people in the local government and below, there are no options. It's only this primary healthcare services. So that's why we need to work. And that's why under our MSCH, we really work at that level, so that we strengthen that relationship between the community and our hospitals, so that our women can really go and deliver in the hospital. And where the services are not good, we will take that voice from the women and take it to the director at PHC and engage with them and make it right.
Thank you so very much. It was such a pleasure having you to share with us what you've been doing in Kebbi State and the environs. We wish you all the best, Doctor.
Thank you very much. Yeah, it's my pleasure to be with you. Thank you.
Let's go on a quick break now. We'll come back and move on to our next sponsored segment. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.